Malaria is a life-threatening disease spread to humans by some types of mosquitoes. It is mostly found in tropical countries. The African region continues to shoulder the heaviest burden of malaria. According to the latest World Malaria Report, globally in 2021, the region counted for 95% of all malaria cases, that is 234 million cases. 96% of all malaria deaths, that is 593,000 deaths. Nearly 80% of all malaria deaths were among children under the age of 5. In 2021, 4 countries in the African region, including Nigeria, 26.6%, the Democratic Republic of Congo, 12.3%, Uganda, 5.1%, and Mozambique, 4.1%, accounted for nearly half of all malaria cases globally. Despite the progress made in intensifying malaria control and prevention approaches, as well as aligning efforts to eliminate malaria in Uganda, the disease remains the leading cause of morbidity and mortality rates in the country, especially in children. More than 90% of the country has stable malaria transmission, with malaria infections occurring all year round. Although malaria affects both men and women of all ages, gender and youth dynamics play a key role in determining health outcomes of individuals. Maternal, newborn and child health indicators are poor, unevenly distributed across the country, and worse in specific vulnerable population. 28% of maternal death occur in young women aged between 15 to 24 years, and here remains a shortage in health workers. The disease causes immense detrimental health effects and responsible for 30 to 50% of outpatient visits and 15 to 20% of hospital admissions. The average economic loss in Uganda due to malaria annually is over $500 million. In 2021, World Health Organization reported that there were an estimated 13 million cases and over 19,600 estimated deaths in the country. The burden of malaria, according to the Ministry of Health, is highest in southwestern and eastern regions of the country. We moved to the eastern part of the country in Mbale district to ascertain the malaria burden there. Leaving our vehicle at a distance of about 2 kilometers, we move on foot to Miss Sarah Liata's home. The mother of 8 is quick to admit that malaria is the greatest burden at their home, depriving them of almost every penny on treatment. Liata and her family cannot do much to prevent malaria because their home is surrounded by mosquito habitats. Rice growing is the main source of income in this community. Rice is grown in swampy areas, which is a suitable habitat for mosquitoes.
You realize we also do rice growing around our areas, just down. Yes, there are some swamps down here, and those are one of the harboring areas for mosquitoes.
There are swamps around, and people cultivate rice, and those are great breeding places for. And then we have quarries where people pick, maram and what have you. And those are also other breeding grounds. And like you can also see around the place has a lot of trees.
At Sira Health Center 3 is where Liata and her family seeks medical attention whenever attacked by malaria.
For us, our service we offer now mainly is they come, we test, we prescribe, and then we advise them to go and buy.
In this very facility, last rotary year, we held here a medical camp.
How was the experience?
Yeah, the experience we had was that there was a lot of malaria cases. We came very early in the morning with enough medicine, and we thought that would be good enough to take us, say, up to evening. But by around 2 o'clock, the drugs were all finished. And there were still very many people.
The fact that people have to come here, then they're told they have malaria, but with no medication, and they have to be given scripts to go back and buy with no money. So I definitely think more work is needed, but of course with the Ministry of Health to supply medication. But also I feel like other organizations like Rotary itself, it needs to initiate more groundwork where there is psychosocial support, because you look at it in the perspective that someone has gone to a healthcare center thinking that they're going to get medication, and with no medication, they're told to go and buy medication. The stresses, health concerns, the stresses, which I think definitely is going to lead to suicide ideation.
The facility, which is located in Bumbobi sub-county, about 10 kilometers away from Mbale city, is serving a population of over 10,000 people from Bumbobi and the neighboring sub-counties, making it easy for drug stock-out.
We have been having a challenge of anti-malaria stock-outs. We realized we last received as a facility anti-malarials on 18th of November 2022. Until date, we have not received.
Some people are very, very poor at seeking what? Medical attention. So someone will say, okay, I'll go to the facility. There are no drugs, so why should I go there? If they are able, they'll just pick some herbs, but still that is not enough. So we need to equip the VHTs to do the sensitization, but also to do the test and treat, and also be able to encourage people to come to the facilities.
Mwema Noah, a lab technician who also dabbles as the assistant in charge, Sira Health Center 3, interfaces with the patients on a daily basis who visit the facility seeking for medical care.
We have tried to reach our communities and talk to them on the proper use of mosquito nets, which government has been giving, but you realize some still have challenges on how to use them, because
So what do they use them for?
you find them sometimes on their gardens. Yes.
Over 50% of all admissions and outpatient visits are as a result of malaria. The facility uses a microscope and rapid malaria tests from the Ministry of Health to confirm the cases.
Government supplies us with the rapid test kits and then the microscopy. We do blood smears.
From January to March this year, a total of 2,168 cases were tested, out of which 957 turned positive of malaria. 364 of these cases are children under the age of 5. The malaria positivity rate at Sira Health Center 3 stands at 44%.
Malaria is a national problem. It's not only here in Sira, though Sira has a very big number compared to other areas.
We realize that most of our big numbers come from our neighboring sub-counties. Our clients, we receive over 2,000 clients at the outpatient department, and over 500 from maternity, the side of maternity.
Within Mbale, we've had an increasing percentage in the malaria cases. That is between 45 and 48. Those are the percentages we usually get. At least on every quarter, those are the percentages. So as Rotary, we noticed that the malaria case is really serious here in Mbale.
The Rotary Club of Mbale Metropolitan, whose focus is disease prevention, is among the players from the private sector in the fight against malaria in Mbale district. The club's projects tailored on awareness on malaria in the area has registered a great impact. However, a lot is still desired.
You know, one of our focus areas at Rotary is disease prevention and treatment. So we try to do interventions. Those interventions cannot be done as a club alone. We need some funding to, say, equip the village health teams to be able to do test and treat on door-to-door. And that can only be done if there is some support from out.
Rotary one time helped to eradicate polio in Uganda. And indeed, polio is now completely down. So some of the Rotarians decided and said, now, let us shift focus from polio to malaria.
It's very crucial that more work is being done for the people. Having visited the families down in the communities, they still need, I guess, more intervention in mosquito nets, medication itself, but also the psychosocial support.
Cerebromalaria and malaria anemia are associated with neurodevelopmental impairment in African children. Over the past 15 years, it has become clearer that many survivors of cerebromalaria sustain brain injury and 25% have long-term neurologic and cognitive deficits. Cure Children's Hospital Mbale, specialized children's neurosurgery hospital in Uganda, last year received over 1,000 children with malaria cases, some of whom were in critical conditions.
Of course, we had to treat maybe about 50% of them within the hospital, and others had the severe form and they had to stay for a couple of days, and it costed us millions of money just in terms of treatment alone. But if you put together the human resource and the time of stay, it amounts to much more money.
To reduce the burden, the facility is embracing community sensitization and awareness about malaria prevention and control, because most times they are limited with lack of enough space where they can admit those with severe cases.
Because prevention is cheaper, it has minimal effects to the patient and to the country at large. But I think more has to be done with regards to patient education, like sensitization of the community. Because however much we end in our facilities and give them mosquito nets without reaching out to their homes and understanding whether they are actually using them, if they do, are they using them well? Are they serving the right purpose they are supposed to serve? And what are we doing about their homes? Are we doing anything?
The Ministry of Health has worked with different stakeholders and partners to improve integrated community case management and strengthen disease surveillance and many other interventions, but malaria remains the biggest burden of Uganda's population. Hence, a lot is desired, and you can be a part of this campaign. However, awareness and sensitization campaigns acquire resources and funding, and everyone can play a part in the fight against malaria.
But I also think without medication, without training, without support, that one-on-one support to let families, without the support of clinicians to exactly understand how to tackle the psychosocial mindset when people come here without medication, more work is still needed, as mentioned before. But I also think more funding for Rotary to do more work, more funding through other organizations, more funding from the Ministry of Health, so that these issues are literally looked into deeper perspectives.
Donating to reputable organizations that support malaria prevention and treatment programs, volunteering time and expertise, and sharing information with others are all valuable contributions. We must come together to raise awareness about malaria and take action to reduce its impact on individuals and communities. By working together, we can create a healthier and safer world for all.